So, guys,
Yeah.
what we're going to do now is I'm going to act like oral component candidate, and I'm gonna be quizzed by Sam on some of the questions. Would anyone like to see me getting questioned?
I hope they say yes. Someone say yes at least.
Well, they want to see me. They want to see my brain on fire, right? So, this is what we're gonna do. Sam is going to ask me a question, and then followed by some questions. He's gonna give me a scenario. I'm gonna read it, make my notes, and based on that scenario, he's gonna ask me some follow-up questions so that we can show you how are you going to react in your OCE in future or in your oral component. So the conversation is gonna be between me and Sam, and we're gonna discuss the case. Is that right, Sam?
Yep, perfect.
All right. Okay, cool. So here you go. You run the show, and I'll be your candidate.
All right, perfect. Okay, Ravneet. So there is a question right in front of you. You have 1 minute to think, prepare your answer, make your notes, okay, if you need to.
Yes,
And
sir.
I have set my timer. Once the timer goes off, we'll start, okay?
Sounds good.
All right.
Man, I feel pressure.
All right, couple more seconds.
I think I got all the information.
Yeah.
Do it.
All
Yeah.
right, good. Okay. Are we
Oh,
good?
wait. Was I supposed to read the first paragraph also?
Well, it's a
I,
whole case for you.
yeah, I just
Hope you
focused
have
on the
read it
second
all.
paragraph for a reason.
Right, all right, 10 more seconds.
Okay.
Okay, Ravneet. So what I'm going to do is I'm going to give you a question. Okay, so there will be a first core question. Try your best to answer, and then we'll go over to the feedback at the end. Okay, so here's
How
the
long
first.
do I have to answer this question or think of this
Well,
question?
you will get like probably 40 seconds to 50 seconds to read the question. You will
Okay.
have another 40 to 50 seconds to prepare for your answer. Try your
Okay.
best to be very concise with your answer. Need not to overstretch it. Need not to get off track as well. But yeah, you will have like on and off 1.5 minutes with reading and preparing your answers for the question. Okay.
All right. Do
So
you think this patient will benefit from physiotherapy services? I think yes, this patient will get benefit from physiotherapy services because clearly this patient has pain at rest and at movement, and this patient has pain from like last 3 weeks. It's a shooting pain, so I'm assuming that this patient has a cervical spondylosis. Um, on the left side, there might be some nerve impingement. I don't see any red flags, so I will treat this patient.
all right. Anything else that you want to add on here?
Um,
If
I
you
do
think.
have relieving factor for this patient, which is placing the arm on the tummy. Um, I might, yeah, educate the patient for the most relieving position, but yeah, I'll treat this patient.
All
Looks
right.
like this
So
is in the scope of physiotherapy.
all right. That's perfect. Okay. So let's move on to the question two,
All right.
which is as follows.
What
Yeah.
do you mean by red flags? Red flags basically means if something I notice which is out of scope for physiotherapy and I want to refer the patient to the physician for a referral, or something that's more than just musculoskeletal and it could be something systemic. Um, yeah.
All right. Perfect. Question three. Can you think of any red flag here based on the given scenario?
I don't see a red flag.
Mhm.
I see shooting pain, nerve compression. Um,
Can you think of any possible red flag? Like even though it's not mentioned in the scenario, but
can anyone help me here to think of any red flags? What do you guys think? I would say if this patient had a shooting pain, which is non-musculoskeletal origin, that could have been a red flag, like cardiovascular. Thank you, Soumya. Could be cardiac arrest, because this patient pain increases with the movement. So if I assume that this patient pain increases with any movement, not just the shoulder, then it could have been a red flag for this patient.
Mhm. All right. Anything else you want to add on here?
No, I think that's it.
All right, no worries. Let's move on to the last question then. How will you check your own competency? You mentioned that you will accept this patient, okay? But
Yeah.
how will you check your own competency? What steps you will take for that?
I mean, I'll just copy paste this case in ChatGPT and see if my answers are right.
Well, you cannot do that in exam, unfortunately.
I mean, can I do that in the real?
Maybe right now, yeah. Or maybe someone can help you in the chat box.
How do I check my competency, man? I'm a therapist. How do you check my competency? I have my
Just
degree.
think very simple, okay? Don't go with the words, okay? The words
Okay.
can be very tricky at the time. Just think what the basic core of a question.
How do I check my competency? Maybe I'll take a second opinion if I'm going in the right direction. If I ever feel that this might need extra set of eyes, I'll do a peer review probably to check
Hmm,
if I'm doing right or not. Or maybe I'll just refer a textbook, to be honest.
perfect, okay.
Yeah.
Yeah, that's it. That's it. Yeah, that's how you answer.
Yeah. See how people are happy?
Right. Oh yeah, I saw the
Right.
I saw the comment. Make him
Yeah.
sweat. Haha.
Yeah.
I hope I did a good job.
Well, I don't know if I did a good job or not.
Well, you certainly did a good job, Ravneet. That was
Uh,
really very well done. Something that has to be kind of corrected, like very
Okay.
minor things, okay? But again,
Sure.
as a point of exam, we just want to be very very careful with our answer, and we just wanted to be very much thorough with our answers because that's your exam, and you don't want to miss any point, okay? So
Right.
yeah, the first thing that I will say is the question will be very simple, very
Mhm.
very basic. So you need to understand that what is being asked in order to be at a point and not to get off track. Okay, so let's talk about the question one.
Mhm.
Do you think this patient will benefit from physiotherapy services? If yes, then why? Very simple question. And the way you answer, Ramni, that was perfectly fine.
Right.
And yeah, that's how you mentioned in your exam as well that yes, I do believe that this patient will benefit from physiotherapy services, and explain why. Okay, so this exam, what it's checking is your clinical reasoning. They don't want to hear which is given in the case. They can already read it. Okay, the
Right.
examiner has already read the case. So you need not to mention the same thing which is given in your case, but you just give a summary that why you
Right.
think that this patient will benefit. So as you mentioned that having a dull pain, sudden onset, gradual worsening, and it's been just there since last 3 weeks, and with the restricted mobility and his functioning. So
Right.
you can say at the end, like based on this all this sign and symptom, this patient definitely required thorough physiotherapy assessment, a confirmed diagnosis, and the appropriate treatment. So
All right.
all this thing falls under physiotherapy scope of practice. And that's why I feel or I believe that this patient will benefit if he is given an opportunity to have an
Right.
assessment. So
Can I ask you a question? Can I
please,
ask you a
please.
question? Imagine if it wasn't shooting, if it was throbbing pain.
Hmm.
And if that makes me think of like throbbing can be arterial pain. Uh,
Yeah.
can I say no, this patient is cannot be seen by a therapist because it's something related, like something out of scope of physiotherapy?
Well, see, if anytime you feel like, okay, something is kind of giving you the indication that this patient has symptom which is out of scope of our practice, yes, you can say that,
All
that
right.
based on so and so scenarios or the so and so sign and symptom, I don't feel myself confident enough to
Right.
accept this patient, or I
Okay.
feel that at this point, this patient need more treatment or another referral like physician or
Mm,
the emergency services. That's how
okay.
you can frame your answer.
That's
Okay.
great. So,
But
which
at
means you
that
don't
time,
have to
yeah,
have an extreme side. You can say, I don't feel
definitely.
comfortable. Maybe let me get some more details on the patient. That's a great
Yeah,
point.
yeah. Or you can
Okay.
even say that, okay, I would still like to go ahead with my assessment, or I would like to see what are the other sign and symptoms this patient is having to
Mhm.
support or confirm my diagnosis or my thought.
So, are
Okay,
you
so
saying as long as I can justify my answer and it makes sense, they won't cut my points?
exactly, exactly.
Okay.
You need to put your point, and once you say anything, you need to have a very clear reason for that. Okay, it's
All
not
right.
like you just mentioned something. It's you need to give them a rationale. Why do you think so? And what are your justification or what are your resources for that? Is that the evidence-based practice?
Sounds
Or
good.
maybe any meta reviews or any peer reviews that has been done already. So that's something you can always use that based on so and so research or the so and so detail. I'm telling that or these are my references, and
Awesome.
they're not going to cut you if you give them a proper resources, right?
Okay. Yeah,
So
sounds
that's
good.
all about the question one, and you did really good job with that, Ravneet. Question two, red flag. Perfect. The way you answered, that's the perfect way.
You see, I
um,
have a complaint though, because they all wanted me to sweat, but no one is appreciating me for my right answers. I
they
would really
might do
like to
at the
see
end,
some
I guess.
encouragement towards me.
They
I'm
just
kind
want
of
to hear
upset.
the report. They just want to get your report card first, and then they will
Yeah.
appreciate you.
Well, that's what we
So
assume, right?
yeah,
All
that's a
right.
good comment. Yeah. So yeah, the red flag is definitely something like it can be a silent symptom, it can be the patient complaint from the
Right.
history, or it can be any of our observatory finding, which makes us feel that hey, come on, this is not in our scope of practice, or this is something definitely needs to be seen by the family doctor or through the emergency clinic or the emergency doctor. So all those things we cannot treat as a PT,
Right.
and that requires the appropriate referral, and that's what we call the red flag, that
Right.
we're not going to accept the patient, but we're going to definitely refer him to the appropriate personnel. So that's something you have to mention, that if I notice such red flags, I will
Mm,
refer this patient to so and so specialty. You cannot just
yeah.
say I'm not going to accept. That's the incomplete answer. So
Let
that's
me ask you a follow-up question, Sam. When I read the question, what do you mean by red flags? For a moment, I stopped myself because I wasn't sure if it's a definition or if it's related to the question. So let's say if I give a definition, but it was related to the question, am I in trouble?
not at all. Well,
Oh,
at that time, if the examiner feel that, okay, you know the basic idea, they
yeah.
can ask you, okay, can you elaborate it with the
Okay.
example? Then at the same
Okay.
time, you use the given scenario, you use
Okay.
your own knowledge, you use your own thoughts to give them
Right.
example. As long as you are providing them the appropriate detail, there is no wrong or no right thing. Okay, all
Okay.
they need is the appropriate answer related to the question. It can
Sounds
be
good.
given in the case, or it can be related to the case, or maybe some other example.
Yeah.
Okay. But yeah, you should be able to explain it with at least 2 to 3 options. You cannot
Right.
just say, okay, that's the only red flag I can think of. Well, you
Yeah.
can say that, but if they ask for more, then definitely you should be able to think couple more, as you
Yeah. I'll
mentioned
be
in the
honest
in
with
the
you.
question three.
You were making me nervous when you said you want to add something more. I'm like, dude, I just said everything,
Well,
What
well,
do you want me
anyway,
to
that
add?
was our third question, right? And you
Yeah.
explained everything so well, like it can be the cardiogenic origin, it can
Right.
be related to the heart, it can be the nerve issue,
Yeah.
or it can be the another thing that I was asking is it can be the dislocation, or can be the
Mm,
subluxation. The
yeah.
way he's resting his arm onto his tummy,
Yeah.
supporting it
That's
with the
internal
other arm.
rotation of the shoulder.
Yeah, so that can
That's a
be
great point.
that
Yeah.
can be anything. Okay, so that's how whenever they ask like, can you add anything else, or
Mhm.
can you add on more, at that time take a pause. Nothing wrong if you ask for a minute or probably a couple seconds, but think you need to come up with the new ideas or
That's
with the
great.
new option if there are any. If you feel that you have covered enough detail, that's fine, just openly say that I guess I have covered enough detail on that.
Awesome.
But if there is a possibility, definitely we want to use our brain.
Great.
Right? So that's the thing. Yeah, so you did good job with the question three, for sure. And now the last one, the tricky one. Okay. Question four, competency. So as I said, don't go with the words. In the exam, they can reframe the question in any way. They can use so many heavy synonyms. They can use so many heavy dictionary words. Okay. We need to understand what exactly they are asking. And your answer was perfectly fine. The peer reviews, how we can check
Mm,
our own knowledge, how we can check whether we are competent enough to accept this patient or not. Technically, this exam is doing the same thing, checking our competency,
of
giving us a
course.
license, right?
Yeah.
So what we are doing here, we are refreshing our knowledge. We are
Right.
reviewing all the detail again. We are
Yeah.
going back to our books. We are checking the evidence-based practice. We are checking all those theories. Okay, so all this thing, what we are doing is we are revising our knowledge.
Right.
We are looking after our formal and the informal training that we all have received in our back home or in our practice setting. So based on all this thing, we are checking that, okay, have we received this kind of training or have we seen this kind of patient before? If you
Mm.
think, yes, I have seen this kind of patient before, I have heard this kind of complaint before, and I have treated them as well, and they all have received positive outcomes, it means you have a competency.
So
Okay,
you mean to say I could have just said that I am an experienced therapist from where I come, and I've seen a lot of patients with shoulder pain who have similar kind of issues, and I've treated a lot of patients, and I feel confident about treating this patient. Can I just say
exactly.
this?
Along with that, you can add on your reference that I have received a training for that based
Mm.
on my education, based on my formal informal training,
Mm.
based on the knowledge that I have. So
Okay,
all this thing gives me more confident to accept this patient or make me eligible or make me competent to accept this patient for physiotherapy services.
that's
So
great.
that's something we can always add on. Like, so all you have to do when you check your competency, all you have to do is you have to self-reflect on your knowledge, on your
Mm.
skill, on your experience. That's something we can always mention to them, and we can kind of form the whole answer.
Okay.
There is a comment says the use extra certification as argument word. Well, if you do have the extra certification which is related to our field, then yes, for example, if you are rostered for any controlled act, like you can perform a dry needling, and if you have a certification to do the same thing in Canada, then yes, because you are taking your Canadian physiotherapy examination. So that's something
Mm.
we always have to make sure that whatever education or the certification we have, and you want to add on in your answer, that should be related to the Canadian physiotherapy education as well.
I
Okay,
mean, just think about it. There's no perfect answer to this. I could have just said,
exactly.
I've been working for 6 months and my supervisor is very much satisfied with my performance anytime I see a shoulder patient,
Exactly. You can say
right?
that. You can say
Mm.
that. So it's all about like you need not to stick with any one format.
Yeah.
Okay. You need not to use only my words or your words, but
Mm.
you make your own answer based on
Yeah.
your comfort, based on your thinking.
Mm.
And just making sure you have a rationale for that.
Yeah.
And that's it. That's all this exam is checking. Nothing, it's not checking how good you, how much language knowledge you have
Right.
or how proficiently you are speaking. All
Right.
it's checking is how
Mm.
critically you are answering it, what kind of rationale you are using in order to prove your stuff. That's it.
That's a great tip. Awesome. Do you want to answer some of the questions in the chat before you go?
I can for sure. It's a pleasure. So, Rima, would the exam be exactly like this, visual and the audio by the examiner? Yes, definitely the exam will be the same. You will have the two examiners, two different examiner in front of you, and you will be seeing them, they will be seeing you, and there will be audio and the visual thing. You can use a headphone, but making sure they should not be connected via Bluetooth. They should be
Yeah.
connected by a cable.
Right.
That's the exam guideline. Okay, but yeah, it will be same like this, visual and the audio.
Right.
Naturally, should we expect a lot of what the diagnosis is question for the scenario? Should we expect a lot of
Which means differential diagnosis or
well,
examination
they
question.
can, yeah. Well, typically the case one itself is a more of the assessment based question where they can ask you what will be the diagnosis. So the case study will be similar to this, definitely a little bit longer than this, of course. But yeah, you can expect a question like what can be the clinical impression? What can
Mm.
be the diagnosis? Or give me any 2 to 3 differential diagnosis. So this
Mm.
kind of question you can definitely expect in your exam, and they have their own marks. Okay, so you have to be very thorough with the condition, with their sign and symptom, as well as the differential condition as well.
Yeah.
I hope that answered your question, Natalie. And Sakshi, if we have worked in a different countries, can we mention that? Well, you need not to name all the countries that you have worked in. Okay, you can say like based on my prior experience working in a field of physiotherapy for 10 years. Okay,
Mm.
that will be more kind of the formal answer rather than pointing out each and every country that you have worked on. Okay,
Mm.
so that's something you can always say, be kind of neutral with your answering.
Yeah. I don't think they'll believe me if I say I've worked in Japan. But great work, Sam. I'm so happy that we did it. I hope that a lot of you were able to answer with me. And how many of you would like to see this again? 5 seconds. None.
Okay. I guess I did a good job.
You did a
I
great
got
job,
scared
man.
literally. I'm like, hopefully no one said no, no, we don't want him anymore.
No, it's a great. I think it's really nice to put things into perspective.
Yeah,
So
definitely.
that's
Definitely.
great. I
Yeah.
appreciate it, Samarth. People
Pleasure.
are
And thank
happy.
you
They're
very much
impressed
for
by
you
me
as well, Ravneet. Thanks for being a candidate and making me more comfortable here. That
for
was the very
sure.
first time, but yeah, you really helped me a lot, and yeah, you did really good job, and I'm happy to
Awesome.
say that you passed.
Yay!
Yeah,
I'm
so
I'm
that's your
registered.
report card. Yeah, that was
Awesome.
very well done.
Now I'm registered. I get to work with Final Frontier. I can
Perfect.
teach.
Yeah.
All right. Great work, Samarth. You have a good
Thank
night, and I really
you.
appreciate it. We'll do that again very soon. Hopefully,
Definitely.
at the different cases and different scenarios, so that
More
we
than
can
happy to do
cater.
that. For
Yeah.
sure. For sure. All right. Good night,
If
everybody.
any,
Take care.
yeah, if anyone wants to start working with Samarth on their one-on-one for their OCE or for their CPTE, if they don't feel comfortable talking, feel free to let us know so that we have the availability. I just received an email. Some of them wants to book the mock exams, so we'll start working on that. But again, we have a very efficient team who can actually give you difficult time during the mock exams.